Morphology of the face over time. Everyone's familiar with what a skull looks like, what an adult skull looks like. But when you look at a child's skull, most people are a little bit surprised because child's skulls look significantly different, as children's heads and faces do look significantly different. And the skull grows differentially over a period of time. One thing is that the brain it grows first. It grows before most of the rest of the body. I mean, you look at a baby is about a sixth, maybe more, head. But an adult is between a 10th and a 20th head. So the proportions and the dimensions have changed over a period of time. And the head stops growing with a cranial vault. They say you can buy a hat at sort of 9, 10 years old and wear it for the rest of your life. So this section of your head has then stopped growing. Now, this is of very, very great importance to orthodontics, because within orthodontics we're trying to understand how the teeth are going to line up and how the jaws are going to line up and the whole growth of the head and the face. One thing that I've often noticed is how when orthodontists look at these x-rays that we take, that we'll take the measurements, we'll take the angles, we'll make precise measurements and relay that to the treatment. And the comment often is, well, this person's from a different racial group to that person, and so you can't use these particular measurements that were taken from a different racial group for that person. And that seems very valid, that seems well thought out. However, all of these normative data from the x-rays were taken on adults. And how does that relate to children? Because it doesn't relate very well. In fact, it would almost seem silly to worry about the racial group, which actually is not very great. There's no great differences between racial groups. In humanity, we've got a very small gene pool. But it would be silly to worry about that and then completely ignore the fact there are some really large, gross changes between people of different ages. Because those are far greater than the differences between races. And I think that we should remember that more frequently within orthodontics, or frequently when your child's having an x-ray, what validity of that x-ray is and what it's going to be used for and how valuable that information actually is going to be if you're trying to account for size changes that go on over a period of time. And of course, although this area may stop growing at 9 or 10, there's good evidence to suggest that this area of the face can grow on for considerably longer. It's one of the principles of orthodontics, is to try and change or affect the growth of this section of the face. And doing so while someone's still growing, which is important if you want to gain the easiest effects, although of course it's always possible to change the facial skeleton after growth, it's just more difficult.